This is our presentation on equine infectious anemia. So now for the introduction and significance. Equine infectious anemia is a non-contagious infectious disease that occurs in equids. Some names for this disease are swamp fever, Coggins disease, and EIA. EIA is a blood-borne and potentially fatal viral disease. It has been prevalent for many centuries and has a worldwide distribution. The US saw the highest number of cases around the 1960s and 1970s, while it's still prevalent today. And although EIA is similar to the human immunodeficiency virus HIV, equine infectious anemia is not zoonotic and cannot harm humans. The virus that causes equine infectious anemia disease comes from the family Retroviridae and genus Lentivirus. This virus can be described as either being circular or ovular shape with a lipid membrane that encapsulates two copies of single-stranded RNA. The RNA will be used to produce DNA that will be incorporated into the host cell. This virus is able to readily mutate, which allows it to change its antigen identity, making it very hard to provide immunization or protection against. Equine infectious anemia virus can inflict three different forms of infection, from acute, chronic, to an inapparent carrier. Acute infection occurs when there are severe clinical signs, and death will usually occur within 2 to 3 weeks. Chronic form is where there will be recurrent febrile episodes or other clinical signs which arise from the horse's immune response after recovering from the acute form. And the final form, the inapparent carrier, where the horse or pony will not show any clinical signs. However, stress may evoke these signs to show. EIA has a worldwide distribution. It was prevalent in the US around the 1960s, and around the late 1970s, EIA cases increased to over 10,000. The most recent outbreak was in 2006 in Italy and Ireland at an equine hospital, and there are still several endemic cases throughout the states. For example, Texas in 2018 reported 24 cases. However, with the development of the serological testing for the detection of viral antibodies, the reported cases for equine infectious anemia has significantly decreased. And as mentioned earlier, equine infectious anemia is a host species specific disease. So an equine infectious anemia virus can only infect equids, and most commonly Equus caballus, so horses and ponies. There aren't too many studies on the infectivity for Equus asinus or donkeys, but from current research, donkeys seem to be either resistant or asymptomatic to the equine infectious anemia virus. The majority of equine infectious anemia cases are reported in horses and ponies, usually of working or showing breeds, and they can be infected at any age, but the majority of infection is seen between 5 to 10 years. So for the transmission, equine infectious anemia is a blood-borne disease, and transmission for this disease can arise for several different factors. The most studied mode of transmission is through blood-feeding vectors, examples of which are blighting flies, horseflies, and staple flies. Transmission can also be iatrogenic, where there is blood contamination of syringes or surgical equipment, and in rare cases, it can be transmitted transplacentally. And we'll talk about that more on the following slides. Here we have the US distribution map for equine infectious anemia cases back in 2018. So there were 51 positive horses in 33 different areas. The majority of cases were localized in the southeastern states, with the majority of cases being in Texas. So now more on transmission. So EIA is a blood-borne disease, so transmission can be through a variety of different ways. One of the ways is through mechanical vectors such as biting flies, horseflies, deer flies, and stable flies. So the possibility of this transmission is directly proportional to the volume of blood that the biting fly or insect will carry on its mouth part. And the majority of this form of transmission is seen during times of high vector population numbers. So this can be during late summer, early fall, when temperatures are favorable for these biting insects. Another mode of transmission is iatrogenic, which is defined as an illness caused by medical examinations or treatment. So this form of transmission is from the contamination from blood of an infected animal on syringes or other medical equipment. And finally, the most rare is transplacentally. It's very infrequent, and it will occur if the pregnant mare experiences repeated episodes of infection. However, this is very rare. Interestingly, from research that I found, studies showed that the rate of infectivity for different modes of transmissions was much greater for iatrogenic transmission. And this is because the blood volume that's found on the mouth part of a biting insect is about 0.001 mils compared to a hypodermic needle, which has a residual blood volume of about 0.05 to 0.1 mils. And on top of that, 1 hour post-feeding of a biting fly off of an infected animal, the virus infectivity will decrease by 99%, and in 4 hours it will be undetectable, while the virus will remain viable and able to infect on a blood-contaminated hypodermal needle for at least 96 hours. So I thought that was pretty crazy. So now onto the pathogenesis. So an animal is infected, and then there is an incubation time of about 7 to 45 days. So after the infection, the viral RNA will undergo reverse transcription, producing a proviral DNA, and this replication mostly takes place in macrophages of the tissue. This virus will then elicit an immune response, which is characterized by the pro-inflammatory cytokines, such as tumor necrosis factor alpha and interleukin-1 and interleukin-6. These will cause a suppression of the production of platelets, which causes thrombocytopenia, one of the clinical signs. And it will also cause the immune-mediated destruction of the complement-coated red blood cells and the prevention of red blood cell maturation precursor cells, which causes the anemia in the equine infectious anemia. And if a horse is infected, they will be infected throughout their lifetime if they are infected, or if they have the chronic form. Either they'll die or they'll live with this infection for the rest of their life. Here are a couple figures that I found in my research. The first figure here shows the viral replication of the equine infectious anemia virus, and the second figure here shows the differences and similarities between the modes of transmission. The top shows the mode through vectors of either biting flies or horse flies, and the bottom is the iatrogenic transmission.
Okay guys, so as far as the clinical signs and diagnosis of equine infectious anemia, the clinical signs can be variable, so you can see anything from one of these symptoms to the entire laundry list of symptoms, as well as even some symptoms that I don't even have listed here. The symptoms that are listed are just the most common. You can see anything from anemia or lethargic. The horse isn't going to be wanting to have a desire to work. They're not going to be wanting to come out of their pens. Weight loss, either minor or extreme weight loss. You can see as much as 100 pounds lost off of these animals here relatively quickly. They can either carry a low grade to a mild fever. Very rarely do you see a case of super high fever. That's why it often isn't diagnosed relatively quickly. As the veterinarian palpates around the abdominal cavity and the stomach, they will find an enlarged spleen and liver. It's one of the more common symptoms to find in equine infectious anemia that can actually even later lead to the findings of the lesions in either that spleen, liver, or even the abdominal lymph nodes, and that's typically seen post-mortem after the veterinarian has completed an autopsy on the animal. Edema in the legs and belly is commonly seen, so you start to see that hot swelling, a lot of warmth within those legs and belly region. You're going to start to see the animal looking stocked up and maybe not being as sound, maybe moving a little bit more stiff, appearing that they've got sore joints. You'll start to see depression in the animals, again, kind of not a desire to work. And jaundice, you'll see the yellowing of the eyes, the nose, the mouth, and the gums. That actually is a very common symptom as well. Now you can also see bloody noses or rapid breathing and increased heart rate, and even bloody stools sometimes. Those are the less common clinical signs, but they can be found in these animals who have been living with EIA for a while. The way to diagnose this is the Coggins test. So a Coggins test is produced anytime an animal is traveling out of state or after a pre-purchase exam. a pre-purchase exam is right before somebody is purchasing one of these animals and planning to take them to their facility. They will take one of the Coggins tests and have a veterinarian do it to make sure that they aren't bringing anything into this herd. The Coggins test is a serological test. It tests for the antibodies in the blood of EIA and is a relatively simple test, but it does take some time. It can take anywhere between 24 and 48 hours to get results back. So with that being said, ELSA tests have recently been implemented as they give much more rapid results, but the ELSA tests actually have a high rate of producing false negatives. And with that being said, that can be pretty alarming with us not having high numbers in the West Coast and this being more on the Midwest as well as more so on the East Coast. So we don't want any false positives, so it is often recommended to actually just use the Coggins tests and be patient. As far as treatment and control measures go, there is actually not a current effective treatment or a current vaccine. There has been a significant amount of research done around EIA with no luck of producing an effective vaccine. The only way to provide treatment is to symptomatically treat, so treat as the symptoms appear. Obviously with lesions and enlargement of the spleen and liver, often you'll lose a horse from that. There's not very many horses that can come back from something like that, but you can easily treat weight loss by implementing different supplements, different feed programs. You can treat the edema using cold compression and regularly icing legs and keeping legs stretched and regular exercise. You can treat some of the rapid breathing and increased heart rate, treating similar symptoms to flu-like symptoms or spring coughs and colds that these horses get. And the only way to control it is really any horses that are competition horses or exhibition horses, and if any of these horses are going to be traveling across state borders, that Coggins test really needs to be implemented and administered. The Coggins test must be done at least every year, and it can be good for up to 6 months. So for horses that are traveling around year-round, they actually have to have 2 Coggins tests. And that Coggins test actually has to be in the owner's hands at all times. So when you cross state borders, you actually have to pull over at the ag stations and provide health certs, Coggins test, and your horse's papers to provide adequate documentation to get your horse across state lines and into different events. Anytime that a Coggins test may actually also be implemented is when a horse is changing ownership. So if the seller is getting ready to sell an animal to a new owner, the owner will have the ability to request a vet on site to have a pre-purchase exam, and part of the pre-purchase exam is actually receiving a Coggins test that you pray is negative to help prevent the spread of equine infectious anemia. Pre-purchase exams also evaluate lameness and soundness of the animal, as well as alertness and making sure that all portions of the body is functioning correctly. And giving your horse a grade scale to what their weight and their body management is as well. And any horse that has a positive antibody needs to be maintaining a safe distance from other horses. So that horse can't be turned out and brought in and then having the herd go back out to the pasture where that horse was. You don't want any contact whatsoever. The horse should be isolated, either on or off the property, but away from any of the other herd that is on the property. Okay guys, any questions? Okay guys, thanks for listening. We appreciate you. If you guys have any more further questions or want to dig into the research of EIA a little bit further, any of these references are fabulous and I would check them out.